Hello and welcome to OET Masters. We are young experts. I, Nikita Kaur Chopra, will discuss today writing for OET, that is Occupational English Test, the updated version with you. What we need to do to prepare for this task. Let's see together. As you can see on the screen, what to do when you get your writing task first. That means when you have been given your writing task to read only, but you cannot write. So then what you need to analyze. So let's see on the screen. Use your time effectively given for reading the task. First, read the writing task, that to whom you have to write the letter to. Third, read what is the type of letter, follow-up, home visit, refer or transfer. Next, underline the relevant notes. This is really important that you need to mention in your letter. That is your data selection. Finally, start the task as per your writing task format. Let's see that what example we can consider today to make you understand that what writing task needs from you. As you can see on the screen, it is the task exactly which will be given to you during your examination time. It says 40 minutes, that is time allowed to you to write. What you need to do, read the case notes below and complete the writing task. So you have also read the case notes in your 5 minutes. Now, today's date, whatever the date they have provided, as this letter was taken from July 2019, so we have this. Then you have been given the notes, which is introductory of the patient and what happened to him. Patient history, of course, the examiner really wants to confuse you, where you're gonna be looking at what you need to delete from your writing, what you're not supposed to write. So of course, patient history will be definitely long, and of course, the futuristic points can be long too. So you have to be very, very clear that what to write and what need not to be written. If you anyhow write one extra line, that's absolutely okay. That's human error. You're not supposed to write the perfect, but yes, near to perfect. Let's see on the screen what does the next task in the continuous says. So that's social history. Yes, you'll be given a social history where you will be told that if the patient speaks your language or not, if the patient requires interpreter or not. Medical history, which is really important. For here, for this example, you see that parents state that both children had some kind of vaccination at birth, but the vaccination record has been lost. Parents are unaware of vaccine for mumps. This is very usual task. Then you have a discharge plan. Remember, any of the point in your discharge plan cannot be skipped. You have to give to the reader of your writing that what is futuristic points, what is the discharge plan, what is your future steps. So let's see the next. Now, generally in the task given to you has the information which we have together read it. Next is what is the exact task, what you are supposed to do through this provided information. So let's see that. So using the information in the case notes, write a letter to the director, Community Child Health Services, so and so address, requesting what type of letter is it, follow up of his family. So in your answer, expand the relevant case notes into complete sentences. What is the trick here? Grammar. Do not use note form. Absolutely not. You're a medical professional. You can only use the abbreviations which are common for all, not the ones that is exclusive for you. Next, the body of the letter should not be more than 200 words. That's the word limit, and use correct letter format. The format, let's discuss that. The next you can see on the screen is that what things you need to be prepared prior, before that, you're thinking to attempt. So let's see, go through the notes such as read the writing task, check to whom the letter is to be written. For example, let's see the task we have generally seen in our last example. So it says to the director, right, of a child health service. So you should be sure that whom you're writing the letter to. Next, check the type of letter: transfer, referral, home visit, or else. The very common is referral letter. Next, read all the points of discharge plan carefully. Yes, because you need to make a paragraph out of it. The discharge plan cannot be skipped. Read the left case notes and underline the relevant points to be mentioned in the letter. If you're not sure whether, for example, a social history, the age may be that the guy is old in some example, you're supposed to mention that or not. So it's up to you, because then you're so confused that you can't read or you can't think of a logical reason. So I would say, rather to be confused while you practice, make errors so that you learn. Next, start writing the task as per the writing format. Writing format is the ultimate important step. That is your base. You have to know the correct writing format. The next is try to complete the task 5 minutes prior and do proofreading. So take care of the word limit as well. Now, why is proofreading important? See, of course, you cannot change lines, you cannot erase your entire paragraph and write again. But then you can do proofreading to just eliminate either your spelling mistakes or your grammatical errors. So let's work in that way. Let's read for 5 minutes, plan, and then write. And yes, important step, proofread, just for your spellings, grammar errors, or somehow you're confused about. So you can correct that sentences too. So this was about your writing task, and we can also talk about further an example. For here, which says the director, right? So as you can see on the screen, that write letter to the director. So keep in your mind that what is the job responsibilities of director about selecting your notes that you're writing to the director. So you have to be sure. And here you can see that we have follow up the type of letter. As you can see on the screen, the discharge plan that I was discussing with you before has 3 points here. So first, that read all the points of the discharge plan given and use in the letter, and request the reader to consider the needs of the patient. So all these 3 points are really important, and you are supposed to put these points in your letter. Now, at last, we conclude that read the rest of the notes thoroughly, including what? Patient's name, age, gender. Why age is important here? To just tell you that either the patient is young, old, or an adult. So of course that's important. Next, admission or discharge date. Why? Because you have to write in your introduction that will be discharged tomorrow, today, next week, what? So you need to see that. Present condition. Is he under observation? Is he he just had a surgery, or he is about to get fit and will be discharged soon? Treatment, medical, surgical. Improvements in condition. So note, mention points relevant to present condition only. Example, patient is having car, and that has nothing to do with patient's condition. If, of course, the patient is sick, the patient is in the hospital, and it's given to you that the patient has his own car, so it is not at all required to be written in your letter. So this is about writing 2.0 at OET Masters, and I hope that next time we will be more students watching this video, and next time we'll be coming up with the format of your writing. So stay tuned, next video is coming soon. Thank you.